Cystic fibrosis, or CF for short, is a disease that passes down through families. It is caused by a defective gene that makes the body produce abnormally thick and sticky fluid called mucus. This mucus builds up in the breathing passages of the lungs, digestive tract, and other areas of the body. It is one of the most common chronic lung diseases in children and young adults. Cystic fibrosis is a relatively rare condition in Malaysia. Between 1987 and 2003, only 16 individuals were officially diagnosed with cystic fibrosis through positive sweat tests. In contrast, the United States is a home to approximately 30,000 individuals living with cystic fibrosis, and the global estimate stands at around 70,000 people affected by the condition. It is worth noting that about 1 in every 30 Americans is a carrier of the CF gene. Cystic fibrosis can affect multiple organ systems in the body, primarily the digestive, respiratory, and urogenital organs. Common symptoms include shortness of breath, respiratory problems, digestive difficulties, reproductive system issues, and salty skin. Digestive symptoms are typically the first to appear, characterized by obstruction of bile ducts, leading to poor fat absorption, liver damage, and blockage of the pancreatic duct. This results in inflammation of the pancreas and potential insulin-dependent diabetes due to beta cell damage. In the lungs, thick mucus blocks the airways, providing a breeding ground for bacteria and causing infections. Chronic infections trigger an overwhelming inflammatory response, leading to airway destruction. Common respiratory symptoms include chronic cough, wheezing, and recurrent pneumonia. In the urogenital system, cystic fibrosis can cause male infertility and decrease fertility in women. The severity of the disease varies depending on the specific mutations present in the patient. The most severe form may manifest within the first few days of life, while milder cases may not show symptoms until late childhood or even adulthood. Generally, the later the symptoms appear, the milder the disease tends to be. Next, let's continue with the biological pathways of cystic fibrosis. The CFTR gene is located at position along arm Q, 31.2 on chromosome 7. In the lungs, the CFTR protein channel used as a channel across membrane cells that produce bodily fluids such as mucus, saliva, and sweat. These channels also help to move chloride ions out of cells. This helps to keep the mucus in the airways thin and watery, which makes it easier to cough up and clear away. Patients with cystic fibrosis arises from a mutation in the CFTR gene that is responsible for regulating the movement of salt and water in cells. Mutation in CFTR affect how chloride is transported, causing sodium and water to leave the airway surface liquid. This results in dehydration of the airway mucus and flattening of the cilia. The dehydrated mucus creates an environment that is prone to obstruction, infection, and inflammation, which then cause thick, sticky mucus builds up in the lungs and other organs. This mucus can make it difficult to breathe, digest food, and absorb nutrients. Let's continue with biotonology approach for the treatment of CF. The therapeutic gene is usually delivered using viral vectors, which are modified viruses that can carry the corrective gene into target cells. Once inside the cells, the therapeutic gene integrates into the genome, allowing the cells to produce functional CFTR protein. This method offers permanent changes for the patient. The mutated RNA will produce non-functional protein, so normal wild-type CFTR gene will be inserted into the cells and thus start producing normal CFTR protein. Lastly, CFTR modulator drugs such as ivacaftor will target the underlying genetic defect in CF and help improve CFTR protein function. These drugs have shown significant benefits in improving lung function and reducing exacerbation in specific CF mutations. Cystic fibrosis cannot be prevented. Screening those with a family history of the disease may detect the CF gene in many carriers. Early diagnosis and optimized treatment prolong the lives of persons with cystic fibrosis and improve their quality of life. That's all for today. Thank you for watching.